These days, marijuana is hard to miss, especially here in New York. You smell people smoking it on the street. You see ever more stores selling it, and its associated paraphernalia. With marijuana becoming as accessible as getting a beer at a bar, are we to assume that it's basically harmless? Today I speak to celebrated psychiatrist and author Dr. Daniel Amen, who has a different idea about marijuana and a host of other things people unquestioningly put into their bodies. Welcome to Vital Signs, where we look at how to get healthier from all angles, from the biochemical and nutritional to the things we do that nourish our minds and our souls. I'm Brendon Fallon. Dr. Amen, thanks so much for joining us on Vital Signs.
Thank you so much for having me.
To start with, I want to get your opinion on this very observable trend we're seeing in America. It's very obvious here in New York, and it's the proliferation of these marijuana outlets. And I'm also seeing these products becoming available more recently, like these chews with marijuana, like THC, I imagine, in them. The whole the trend of this is that marijuana is something safe. It's just like, you have this product. It's just like going to a pub and having a few beers. What I've observed myself is a little different to that. I remember reading a book. It was written by a journalist talking about her son. It was called Tell Me I'm Here. This book's probably a few decades old now. She described her son going on a camping trip, and as far as she knew, he just tried marijuana once. And that was what set him on the path to severe schizophrenia. And he ended up living on the streets and eventually, I think, ended his life. So I'd like your opinion, Dr. Amen, on is this as safe as just going to the pub and having a beer, or is this something we should be looking at more carefully?
If I was an evil ruler and I wanted to create more mental illness, I'd have the policy we have now with marijuana. Marijuana is not innocuous. It increases the risk of anxiety, depression, psychosis, and suicide. If teenagers start using marijuana, and like you said, the idea in society now is it's innocuous. That's a lie. It's not innocuous. It doesn't affect everybody the same. There's some people it doesn't seem to affect them much, but there's a whole other group of people where it increases the risk of psychosis, 450%. I published a study on 1,000 marijuana users. Compared to healthy brains, virtually every area of their brain was lower in activity. I published another study on how the brain ages with over 60,000 scans. And then we looked in our database at what accelerated aging in the brain. And having schizophrenia, that was the worst. But the second worst was someone who'd used marijuana. Marijuana is not innocuous. And when you just think of the messaging in our society, vaping's a healthier form of smoking. That's a lie. Or alcohol is a health food. It's another lie. Or marijuana is innocuous. I've been a psychiatrist for 40 years. So I've seen all sorts of different iterations of marijuana, and I'm just not a fan of it at all.
Is the kind of grade important? Because they sell different variants of marijuana at these stores. Some are advertised as being purer than other forms. Is there a difference in the danger associated with the kind of grade of marijuana that's sold?
Well, I think if you're vulnerable, all forms are trouble, potential trouble. CBD does not seem to have the same problems, and it can be helpful for seizures. It can be helpful for anxiety. The problem is a lot of CBD is also laced with THC, and THC is the bigger troublemaker.
Another, what you might regard as a soft drug, but is far more readily available, readily accepted, and something that many people will say that they can't start their days without, is caffeine. Is this something that needs a second look as well, would you say?
Well, caffeine is addictive. It has both tolerance and withdrawal. it's the world's, most used drug. And I think small amounts are probably okay. But one Starbucks venti coffee is 330 milligrams of caffeine. That's an addiction dose. That if you do that on a regular basis, when you stop, you're going to have headaches and irritability and tiredness and basically withdrawal. So the reason I'm not a big fan of caffeine is it constricts blood flow to the brain. Anything that constricts blood flow prematurely ages the organ. So again, I'm really not a fan of marijuana. I'm also cautious with caffeine. And then, for kids, it's all the energy drinks. They mix caffeine and sugar. It's like two bad things for your brain. And then we're going to get all these sports teams or, famous people to say, oh, I drink Red Bull. And kids think it's cool when that's not something children should be consuming.
What is it actually doing to the brain? What's happening in the brain when someone drinks caffeine?
It constricts blood flow, but it also suppresses a chemical called adenosine. And adenosine is the chemical that throughout the day slowly builds up and it tells you to go to sleep. Well, caffeine blocks adenosine so you don't feel tired. The problem is adenosine is still going up, but it blocks the effect of it and you end up with a rebound the next day. And that's why people start their days with caffeine, because what they're really doing is medicating sleep deprivation. And I would just argue if you get rid of caffeine, your sleep's going to be better, your energy is going to be better. It's a short-term fix that continues to cause a long-term problem.
And I imagine you'd be counseling your patients often in this direction. Things like marijuana, like caffeine, and a host of other things that are having this constrictive effect on the blood reaching the brain. What kind of results do you see? Is there a particular example you could give where you've seen results from giving that kind of direction?
Well, one of my favorite stories is an Air Force pilot who came to see me, and his brain looked way older than he did. And he wasn't using marijuana, but he was addicted to caffeine. He'd have anywhere from 6 to 12 cups a day. And he's like, but I can't live without it. And I'm like, no, that's a lie. You can live without it. I said, and if you want to just stop, well, you probably feel bad for 5 or 6 days. The other option is just go down by 10% a day. And he chose that, didn't have any withdrawal symptoms. A month later, he was stunned with the amount of energy he had, with how much better his sleep was. And it's the little lies we tell ourselves, I often say, that keep us fat, depressed, and feeble-minded. I need this. And the fact is, the brain is lazy. The brain does what you allow it to do. And good habits take just as much energy as bad habits. Now, you have to sort of reshape your brain. That takes a bit of energy, but there's no way he's going back to caffeine. Or a professor from Stanford I worked with, we worked together for 6 months, and then I saw him at a conference recently, and he said, because of you, I wake up 100% every day. And I'm like, oh, well, thank you, because he stopped drinking alcohol, and he thought it was just sort of what everybody in his group did. So he didn't see it as a problem. He didn't get arrested for drunk driving. He didn't beat anybody when he was drunk. but he wasn't helping his brain. And when he stopped waking up feeling foggy, feeling fuzzy. He woke up 100% every day. And ultimately, it comes down to this one question you should ask yourself. When you go to do something, when you go to consume something, is this good for my brain or bad for it? And if you can answer that with information and love of yourself, love of your family, love of the reason you're on earth, you just start making better decisions.
What do you think about marijuana, about caffeine, and other things people put into their bodies without too much thought? If you're watching on TV, you can find Vital Signs online at epochtv.com to leave a comment and let us know your thoughts and experience. You can also follow me on Instagram at see.vitalsigns, and Brendon Fallon on Twitter to get notice of new videos. I remember speaking to a photographer, a commercial photographer, a year back, and he said that he was angry all the time, like he was very rapidly losing his temper, and he decided to cut back on caffeine. And then he said, "I'm a nice guy all the time now," you know. And it's quite a remarkable shift from something as simple as cutting back on coffee. I wonder also about people's behaviors, like anger for one. Is this associated with a particular chemical reaction with that could also be potentially addictive?
Well, it's possible. I have a case in my new book, Change Your Brain Every Day, about red dye. I had a boy who, whenever he got something red, he would have a rage attack. And normally a loving, sweet, good kid, and he'd get something red, either in cough syrup or licorice or colored cereal, and all of a sudden he'd throw things, become completely irrational. I scanned him on red dye, but I was very nice to him that day. And then I scanned him off, and his brain just went boom, became very inflamed when he had the red dye. And another guy who came to see me, that he had terrible temper whenever he got MSG, which is a very common food additive that's often not labeled on foods, or it's labeled as natural flavors. And I scanned him because he said, I get a bad temper when I'm on MSG. So I scanned him off MSG and on MSG, it caused his left temporal lobe, an area often involved in violence, to fire abnormally. And I'm thinking to myself, well, just hold the MSG. Or I could give him medicine to stabilize that part of his brain, thinking he's going to pick, well, I'll just stay away from it. He said, you have to give me the medicine because you just never know what it's in. And if I lose my temper one more time, my wife's divorcing me. And that's going to make me super sad. So I gave them the medicine to stabilize it. But, you know, there are all these little wild cards that people don't know about, right? They're just like, oh, I'm going out for Chinese food. Or, you know, I'm going to have this packaged food. And you have no idea that it may be driving your negative behavior. And it's so easy to blame people. You know, if you see somebody who does something bad, to blame them is bad. And I often think, well, you really should be blaming the brain because the brain controls things. So maybe what we need to do is really be thoughtful about how we love the brain, how we feed the brain, how we take care of the brain.
You mentioned that you're doing scans, Dr. Amen, and I know that in terms of the treatment, the recommendations you make to patients about changing their lifestyle, their habits, it's called the SPECT, the single photon emission computed tomography. That's quite a mouthful. Is that, could you give us a bit of information about that, how that works, and what the role that it plays in your approach?
So I have 11 clinics across the country, and for the last 32 years, we've been using brain SPECT imaging. SPECT is a nuclear medicine study that looks at blood flow and activity. It looks at how the brain works. And it basically shows us three things: good activity, too little, or too much. And I don't know if you know, but psychiatrists in general are the only medical doctors who virtually never look at the organ they treat. Think about that. They make diagnoses based on symptom clusters with no biological data. And a long time ago, I thought, well, that's crazy. It's like, clearly the brain's our organ, right? As a psychiatrist, the brain is our organ, right? It's generally not liver problems that are giving you emotional problems. It's generally not your heart. It's your brain. And so, well, why wouldn't I want to look at it? And the imaging has taught me so many important lessons. Number one, most psychiatric illnesses are not mental health issues. They're brain health issues. Get your brain healthy, your mind will be better. Mild traumatic brain injury is a major cause of psychiatric problems, and nobody knows it. And the NFL owns a day of the week here in the United States, and it's a brain damaging sport. I did the first study on active and retired NFL players, high levels of damage. And even though these incredibly successful people have 4 times the level of depression as the general population. So protect your head. And it's where I learned marijuana is not innocuous and alcohol is not a health food. Vaping is not a healthy form of smoking. That you want to love your brain, take care of your brain, feed it right, stop poisoning it, even with the products you put on your body. Because you know, whatever you put on your body goes in your body and affects your brain and affects your body. So using non-toxic products are really important. And you've heard it said, a picture is worth 1,000 words, but a map is worth 1,000 pictures. A map tells you where you are and gives direction on how to get to where you want to go. Without a map, you're lost. And so SPECT, for me, it's mapping our patients' brains so I can make them better and help them live the life they want.
If someone is interested in having a SPECT done, how do they go about that?
So they can go to amenclinics.com. So amen, like the last word in a prayer, clinics.com, find our locations, call our call center. We love seeing new patients, and we've been doing this for 30 years.
Dr. Amen, I'm interested, your new book, Change Your Brain Every Day, I imagine it's very much centered on some of what you've talked about, this idea of really loving and caring for your brain.
So the book is 366 short essays on the most important things I've ever said. And so I've written 42 books, and a lot of people go, where do I start? And given that we now have a very short attention span in the United States, what I thought I'd do, you know, brain health, just like physical health or spiritual health, is a daily practice. And so it takes 3 or 4 minutes a day, read a short essay, like 250 to 300 words, and then there is a question to answer and a simple habit or practice to put in your life. And there's 366 essays because next year is leap year, and I didn't want to leave you without a day.
Can you give us a sample, Dr. Amen?
Well, so I think day one is your brain's involved in everything you do, how you think, how you feel, how you act, how you get along with other people. And the question, is this good for my brain or bad for it? I want people to take that with them all year long, really for the rest of their life, because they're much more likely, when you love your brain, you love your life.
And where can viewers find that book? Where's the best place for them to purchase that?
They can get the book anywhere great books are sold, Amazon, Barnes and Noble. They can go to brainmd.com and get the book as well.
Dr. Amen, I'd like to go back to marijuana a little bit. You touched on the fact that marijuana, despite its observed dangers, it also has this therapeutic value. I know that people whose family members have benefited, they've been on chemo and or on radiotherapy, and they've benefited from using marijuana, or particularly for pain relief. And I mean, in a situation where someone might face a choice, or they're offered opioid medication to deal with pain, and marijuana is an alternative, is marijuana a feasible choice in that kind of situation, or do the dangers overshadow that?
So I think you always have to weigh the risks versus the potential benefits. When my father-in-law was dying of cancer and he wasn't eating, he used marijuana, and that stimulated his appetite. You know, he wasn't getting out of that situation, and we wanted him to suffer as little as possible. I think situations like that are clearly appropriate. The problem is we've gone from, legalizing marijuana for complex or resistant pain syndromes to making it basically the life of the party drug that's now legal. And I'm very worried about that. And just think, over the last 15 years, where the idea of marijuana being dangerous has gone down each successive year. The incidence of mental health problems in the young are at epidemic levels now. And I actually believe we are on the front edge of a tidal wave that is going to negatively impact our society for decades. And this is happening, especially in teenagers and young adults. When marijuana is the most available it's ever been, we have the highest incidence of anxiety, depression, ADHD, and addictions. And I think they're connected.
I spoke to you about the example earlier about the young man who his mother wrote the book about him virtually having one try of marijuana, and then it led to him developing schizophrenia. This is, I guess, someone who has a particular susceptibility to that. But what does marijuana do? What is happening in the brain that would lead to such a reaction?
Well, it's probably attaching to the dopamine receptor sites in his striatum or the basal ganglia, disrupting activity there. And for genetically vulnerable people, I think for all people, it's like playing Russian roulette. For genetically vulnerable,
really playing with your life to take that risk. And coming back to this method that you use, the SPECT, to kind of map what's happening in the brain. I know you've commented that it's often the case that drugs like antidepressants, I imagine even antipsychotics as well, prescribed without a very thorough examination of a person that I guess something like SPECT would give insights to. Where does that danger fit into the scheme of things?
Yeah, I hate it, really. If we go back to psychiatrists are the only medical doctors who never look at the organ they treat. And virtually all psychiatric drugs have black box warnings. It's not good. I'm so frustrated. Now, I think everybody in my field knows that imaging is the future of psychiatry. But at the rate it's going, it won't happen for another 50 years. And that just seems insane. So much progress has been made in so many other areas of medicine, very little in psychiatry. In fact, in 2023, the big innovations in psychiatry are marijuana, ketamine, and psilocybin. And I'm like, the street drugs of the 60s are making a comeback when, in my experience, if I get people to decrease the time on their gadgets, to exercise more, to eat whole, colorful food, natural colors, they get incredible benefit. And why wouldn't we start with natural ways to heal the brain rather than the risk that things like marijuana, ketamine, and psilocybin bring?
Well, when you put it in that context, it does sound quite radical that these things are being promoted, like the psychedelics, ketamine, psilocybin. On that note, I've spoken to some clinical practitioners who are dealing with people with PTSD, sometimes war veterans, and what I've been told is that in some situations nothing else works, or they've tried all these different things, these different medications and therapies, and so something like ketamine or psilocybin is a last resort. What's your opinion on that situation?
Well, I'm a doctor or a healer. I want people to get better. I think in those situations, that's awesome that we have those treatments available. The problem is the masses want them before they do the right work to get their brain healthy. And so, they're never first, second, or third on the list, but they're on the list, right? If what I'm doing is not effective, if getting your brain healthy, teaching you not to believe every stupid thing you think, working on your relationships and your sense of purpose. If I do all the things I know to do and they still don't work, well, let's try ketamine, especially if you're suicidal. It's been found to be pretty helpful in people who are imminently suicidal to change their state. Or if you've done EMDR, eye movement desensitization and reprocessing, a specific psychological treatment for trauma, and you still can't sleep, you're still having nightmares, then maybe psilocybin's an option. It's just not the first option. And, it's the most common question I get when I lecture: marijuana, ketamine, psilocybin. And it's often prescribed or often done when people are still drinking, when they're still using marijuana daily, when they're eating low quality food and not exercising. And in my mind, it's just not rational. The rational thing to do is stop poisoning your brain, love it, treat it right, and odds are you're going to be better.
It sounds like a very practical approach, and something that lays a good foundation for mental health. Dr. Amen, I wonder also, with people in a situation of mental health crisis where they might be suicidal, or they're having frequent severe psychotic episodes, alongside laying that foundation, and if there's someone who has an aversion to being medicated, what would be a way to deal with that kind of situation?
Well, one of the things we haven't talked about is if they're having a resistant psychiatric illness, the question's got to be why. They go, oh, you have bipolar 2. Well, why do you have bipolar 2? And without looking at the brain, you don't have a clue. Why? And one of the things the scans have taught me is sometimes mold exposure increases the risk of severe psychiatric illness. Sometimes infections. I know COVID changes your brain in a negative way, as does Lyme disease, as does herpes and other infections. But most psychiatrists never test for infections, and that's a mistake.
Roughly, is it possible to put a figure on that? Like in how many cases you would estimate that it's something tangible like this, like some kind of introduced toxin that is causing someone's mental health problem.
At Amen Clinics, we see treatment failures. On average, people have failed 6 medicines before they come to see us. And probably 30% of our patients, it's something else that's contributing to the problem. It's high enough that if I had a loved one with schizophrenia, or I had a loved one with bipolar disorder, borderline personality disorder, I'd want to look at and assess their brain and their body. Right, on virtually all of my patients, I want to know, what's your thyroid? What's your testosterone level? What's your vitamin D level? What's your hemoglobin A1C, your blood sugar level? I want to get your body and your brain as healthy as they can be, because even if you have schizophrenia, you're going to relapse less. You're going to need less antipsychotic medication.
And just to take it back to the marijuana example again, doctor, with the power that this has in letting go of these introduced toxins like alcohol, by cutting back on these things, with the example of marijuana, how do you help patients to kick the habit?
Well, I show them their brain. I mean, that's the first thing. And you can see the trouble in their brain. And for people who are bright, they're like, oh, my brain controls everything. I don't want to hurt it. I don't want to increase my risk for problems down the road. So the scans increase motivation. And marijuana stays around long enough that generally the withdrawal from it is not awful. So motivation, brain healthy habits, is generally how I deal with it. I do a series on Instagram called Scan My Brain, where we take young influencers, scan them, I evaluate them. And one of my influencers said when she came to see me, there is no way I am giving up marijuana. And I'm like, I'm not your mother. I'm like your partner in getting well. But you have a damaged brain, and odds are if you keep using marijuana, it's going to get worse. Well, then she stopped, and she said she couldn't believe how much better she felt, how her energy was better, her focus was better, her memory was better. And, ultimately, I don't see myself as your parent. I just see myself as your partner, and, I'll coach you. Good for your brain, bad for it.
Well, it sounds like, it's often the case that people just don't have the insight into what they're actually doing to themselves by using these different substances, and you're able to give them a clear look at that. Dr. Amen, just lastly, I wonder if you could offer just a short, maybe 3 to 5 things that people would want to do to improve their brain health, like a short checklist. And they can read more, they can find out more by accessing your book, Change Your Brain Every Day.
So thank you so much for a good interview. Brain health is 3 things. Brain envy, you got to care about it. Nobody cares about their brain because you can't see it. You can see the wrinkles in your skin or the fat around your belly and do something when you're unhappy with it. When I first saw my own brain in 1991, it was not healthy because I played football in high school and I had bad habits. The week before I saw my mother's brain, it was stunningly beautiful. And I wanted her brain. So that's why brain envy. I always say Freud was wrong. He was about 3 feet too low in people's bodies. So that's the first one. Got to love your brain. Avoid anything that hurts it. You just got to know the list of what hurts it. And again, most 7-year-olds really have a good idea. And then 3, engage in regular brain healthy habits. I take supplements every day. I start every day with today is going to be a good day. When I have a meeting, I'm generally walking or on a stationary bike. I think exercise is so important to keep your brain young, and I focus. I'm really busy, but I get 8 hours of sleep at night. I'm in bed before 10 and usually not up before 6. So sleep is absolutely essential for brain health.
Some great practical and foundational advice there. Dr. Amen, it's been a pleasure speaking to you. Thank you for coming on Vital Signs.
Thank you so much.
That was my talk with psychiatrist and author of Change Your Brain Every Day, Dr. Daniel Amen. Next, hear about the stirring results of eye movement desensitization and reprocessing, EMDR for treating trauma, and unresolved stress with Dr. Marilyn Luber. You may remember Dr. Amen mentioning EMDR just now. The link to that episode is in this video's description. I'm Brendon Fallon, and this is Vital Signs.